Alright, you're welcome. This is Celebrity Pharmacologist, and today let's look at Diclofenac versus Peroxicam. If this is your first time of coming across the Celebrity Pharmacologist, please do well to like, share, and save this video. Drop your comments in the comment section, especially for those of you that are into pharmacy, medicine, or clinical practices. Please do well to follow me because you have a lot to learn from me. I make drugs very easy for people to understand. Now, today we are comparing diclofenac versus peroxicam. We have actually made a couple of video about diclofenac versus celecoxib, diclofenac versus naproxen, even diclofenac versus ibuprofen. Now, this is diclofenac versus what? Peroxicam. I want you to know that they are both classified as NSAID, non-steroidal anti-inflammatory drugs. They are both classified as NSAID and they work by inhibiting cyclooxygenase 1 and cyclooxygenase 2. They inhibit COX-1 and COX-2. But by way of classification, like a special or a better way to classify them, peroxicam is under the class called the enolic acid derivatives. Why diclofenac is classified as the preferential COX-2 inhibitors. So one thing you should know how they work. So how do these drugs work? If peroxicam is a typical non-steroidal anti-inflammatory drug, so it's a typical, like it's a real NSAID. So it works by inhibiting, it inhibits what? Cyclooxygenase 1 and 2. For that of diclofenac, it prefers to inhibit COX-2. It prefers to inhibit COX-2. When I say I prefer eating boiled egg to fried egg, that does not mean I don't like eating the fried egg. So it prefers to inhibit COX-2. That does not mean it cannot inhibit COX-1 if it sees COX-1. So it prefers what? COX-2. Then talking about the onset of action, like we all said that diclofenac, especially the formulation, which is the diclofenac potassium, it works very fast. So diclofenac, the onset of diclofenac is within 30 to 60 minutes. Some will even tell you it's 20 to 60 minutes. So but let's just say 30 minutes to 60 minutes. It's very fast. But that of peroxicam, it's a little bit slower, which is about 1 to 2 hours. You see, it's a little bit slower compared to diclofenac. Now, talking about the duration of action, the duration of action of diclofenac, we said is what? 8 to 12 hours. 8 to 12 hours. But the duration of action of peroxicam is 24 hours to 48 hours. So it's still active what? In the body. Now let's talk about the half-life. This will now bring us to the half-life. The half-life of diclofenac is within 1 to 2 hours. 1 to 2 hours. Diclofenac will be what? Reduced to by the milligram. That means if you give 50 within 1 to 2 hours, you get 25 left in the body. That's how it goes down. However, that of peroxicam, the half-life of peroxicam is about 45 to 50 hours. Some textbook will even tell you 80 hours. So let's just discuss these little things we've recorded now. This simply means that peroxicam stays longer in the body than diclofenac with this what? These parameters we have gotten here. It also means that if someone is having a chronic pain, you see that peroxicam is actually going to do a better job here because it will stay like its half-life is about 45 to 50 hours. And I said some textbook will tell you it's what? 80 hours or even 70 hours. So, however, when looking at the indication or the benefits of peroxicam, let's also consider the side effects by inhibiting cyclooxygenase 1, which will reduce prostaglandin secretion automatically. It means that for like 45 hours, your stomach will not be having those protective lining. That means you are exposing the stomach towards the stomach acid. So exposing the stomach So stomach acid for up to 45 hours, you are actually what going to increase the chance of having what we call gastric ulcer or stomach ulcer, because you're exposing it to the hydrochloric acid in the stomach. Now that's the disadvantage it has over what diclofenac, but it's a long acting analgesic. Just know that. Now let's talk about the potency. We know that diclofenac is generally potent, is generally better, is generally the best for acute pain, better and potent, is generally better and potent for what acute pain. Like it's you, they are not mates when we are doing this, when you are comparing both of them. Like when we're talking about acute pain, a kind of pain that you need relief immediately, a kind of pain that you need answer, it has a strong anti-inflammatory effect. It can bring swollen, whenever I'm talking about swollen, diclofenac can bring it back to normal because it's very, very strong and potent for that. I'm not saying that Peroxicam still do not have that, but Peroxicam is good, but it's better or it's preferred for chronic inflammatory pain. That's where you should be talking of what Peroxicam. With this also, you can see that diclofenac can be taken 2 to 3 times daily. Can be taken 2 to 3 times daily. However, Peroxicam should be taken once daily. Can someone tell me why in the comment section? Why should Peroxicam be taken once daily if the half-life is this? Someone should explain for me in the comment section. Now let's talk about the what indication. Diclofenac is better for acute musculoskeletal pain, post-operative pain, and even dental pain. Now Peroxicam is better for osteoarthritis, rheumatoid arthritis, ankylosing spondylitis. So these are the conditions where you should be what considering Peroxicam. For when something is chronic, sorry, when it's chronic, when the pain is chronic, then you should be thinking of Peroxicam. But when you need a drug for immediate effect, like dental pain, you know, when someone is having dental pain, that person cannot sleep. Oh. I don't know if you have ever experienced it. Dental pain. You cannot say someone is having dental pain and you are bringing Peroxicam. When with for 1 hour, you see it's better you come with what diclofenac. And I see most people prefer taking Peroxicam. A popular brand of this Peroxicam is what the Fevin. Fevin is very popular. Don't know if I'm spelling it correctly. It's Fevin. It's kind of red. Very popular brand. Diclofenac, everybody knows it. The popular brand is what Fevin. Most people take them for what dysmenorrhea or painful menstruation. Let me use that word. Dysmenorrhea or what painful menstruation. But it's always better to stick to diclofenac. Please, I'm not encouraging self or medication or self prescription, but we are just trying to teaching those who are into medicine, those who are into drugs, those who run pharmacy to understand their first line of drug. That is the major goal of the celebrated pharmacologist. Understanding what the first line of medicine, the first line of drug, or the first line of medication, which you should introduce first. So it's not fair enough to just introduce Peroxicam when you've not tried diclofenac. We've come to the end of today's lesson. Please, if you like this kind of video, don't forget to drop comment in the comment section. Save this video. Follow me because few days from now we'll be coming up live for education. Just keep your questions. I'll be seeing a lot of questions in the comment section. Some are doubting what we are actually saying. I love that. And I want you to also come. Let's discuss why you think if I tell you something on in one of my video, you think it's not correct. We'll discuss about that. See you next time. Goodbye.